Okay, good morning. It's now approximately 1:15 here in Decatur, Georgia, 1524 Lavista Drive in Decatur, Georgia. And yours truly, Dolphy Gilpin, is continuing with his brief lectures, microbiology, microanatomy, and we have reached here the treatment of Osteogenesis Imperfecta. Okay, we have abbreviated as OI. We say now this is Osteogenesis Imperfecta. And we have defined this now as a group of disorder. Of the bone, bone cells, bone marrow, and there were 4 types. All these disorders were described in another lecture. We are here on the treatment this morning. And we say now that the treatment is managed by the symptoms. All right, so we say managing the symptoms. And one, we say managing the symptoms, we minimize fractures. 2, we enhance independent functions. We reduce pain. Here we are managing the symptoms of this osteogenesis imperfecta. And we minimize the fractures, fragile bones, weakened bones. And we enhance independent functions. And we reduce pain. And in general, now we promote general health. Promote the general health. Okay, so we move on now to the treatment of the musculoskeletal treatment. Musculoskeletal aspects of osteogenesis imperfecta. We just abbreviate it as OR. So we're going to be treating the musculoskeletal aspect of the osteogenesis imperfecta. And we use physical therapy. We use fracture care. Orthopedic surgery. ORTHO surgery. use medication to straighten the bones. And we use mobility equipment. Alright, so now as we move on in the treatment of osteogenesis imperfecta by managing the symptoms, we now move to the pediatric treatment. Of no OI or osteogenesis imperfecta. And when we say now, the FDA has approved now, US FDA has approved bisphosphonates or palmidronate. And what we do, we have now intravenous IV BIS bisphosphonates or palmidronate and what this does, this increase the bone density. Well, the name is the zolidronate. I have some other name, Caris or Zamita. And all these pharmacochemicals, drugs, can be started off in neonatal period if the infant can breathe on its own. So we say, this intravenous